Hi, everyone, and Happy New Year 2021. It's fantastic to be with all of you in this fantastic new year starting. I think everybody can say that we're happy that we have put 2020 behind us, and we are wishing a fantastic 2021 with fantastic new things coming our way, of course, right? So welcome everyone to season 4 of Parent Talk, where we strive to parent authentically and continue to grow alongside our children. I'm your host, Genevieve Kyle, mom of 2, and we're broadcasting out of the Greater Vancouver area, and we are proud to provide the most up-to-date expert information for today's parent. Our goal is to inspire you become a more confident, peaceful, connected, and authentic parent. I'm, of course, with my co-host, Heather Fox. Hi, Heather.
Hi, everyone. Happy New Year. Yes, Heather Fox here, co-host of Parent Talk. I'm also a mom of 2. So we all know that parenting is a journey, and definitely one that we shouldn't be taking alone. So we are here to be the best parents we can be, and that means listening and learning, and sometimes asking for questions, and of course asking for help, and that's okay. So our community is going to bring you strength and support along the way, from pregnancy to puberty and beyond.
Awesome. Well, today we're talking about virtual healthcare, and we're excited to have with us Dr. Alissia Valentinis. Dr. Valentinis has been a family physician in Toronto, Ontario for the past 15 years with a special interest in pediatrics and women's health. She is also the Ontario Medical Director for Babylon by Telus Health. At home, she has 2 children, a boy that is 12 and a 9-year-old daughter who keeps her on her toes. So welcome, Dr. Valentinis. It's fantastic to have you with us today.
Thank you, Genevieve. Thank you, Heather. And feel free to call me Alissia.
Alissia, perfect. Yes, I love that. Alissia, first question for you today. Let's do it. So we hear so much about virtual healthcare appointments. So I'm really happy we're talking about this today, because I think this podcast is going to help a lot of people. And also, I want people to know about Babylon. I actually heard about Babylon when we went to one of the baby shower last year. And it was the first time I actually heard about it. But if nobody's not out there, maybe they actually don't know about it yet, right? So let's talk about virtual care. So virtual care has been an alternative for many parents when seeking healthcare appointments. So what are the benefits of using virtual care services like Babylon, Telus Health?
Yes, so Babylon by Telus Health is an option for parents and anyone really to be able to access healthcare in a safe and convenient way. This is a complement to your traditional care. So if you have a family physician, we always recommend seeking them first. They know you best, you have that relationship. But there might be times when you're not able to reach your primary care provider. And that's where Babylon by Telus Health can help. We have physicians available to see patients 7 days a week, evenings and weekends. And those are traditionally the times when families, busy such as yourselves, you have full-time jobs. Sometimes it's in the evening that you finally get around to making that appointment for your child. So our physicians are available. We also really believe in the continuity of care. So if you do have a family physician, we provide a copy of our notes to you as well as to your family physician, so they can know what the plan is going forward, and so that we're all working together for the health of your child.
Mm-hmm. Wow, that's fantastic. So let's see. So now we've got this second wave of COVID. We are right in the middle of the flu season, and that's well underway. So how can we best assess our child's symptoms to determine what the next best steps are when they're feeling sick?
Absolutely. So one thing that Babylon by Telus Health has on their phone app is a service, a feature called the Symptom Checker. So you can use that 24 hours a day, 7 days a week. And it's an AI-powered chatbot that takes you through a series of questions, concerns, symptoms that your child might be having. And at the end of it, it can provide you with next best steps. So it can't provide you a diagnosis, only a physician can do that. but it can direct you to what the next most appropriate care would be. So if it's severe symptoms, obviously would recommend going to the emergency room. It might provide a recommendation to speak with your pharmacist, or it might direct you to speak with one of our physicians. If it does recommend one of our physicians, it's easy to book an appointment through the app once you've registered. And our physicians are able to assess symptoms, order tests if needed. So if you need to have blood tests done or any type of imaging, we can organize that, and then make a diagnosis and prescribe medication if that's what's needed. In some cases, you may need a consultation to a specialist, and our doctors can help you with that as well.
Great.
Awesome. So, okay, how can I make the most of a virtual care appointment? So how should I prepare?
Yeah, so lots of things you can do ahead of time. So the first thing with the Babylon by Telus Health app, you want to download that, have that on your phone, and register all the members of your family for their own appointment so that they're able to book their own appointment. So you want to have all their information already in the app. Then before you book your appointment, you want to get all your questions organized and ready before you speak with the doctor. So what are the symptoms that you're concerned about? How long have you had these symptoms? Is there any specific questions you have for the doctor? Then you want to get in a secure place in your home, make sure there's somewhere with really good lighting, and you book your appointment with the doctor. With a little child, you know, they might not want to stay on your lap perfectly still all the time, and don't worry about that. But it is important that we actually do see your child. So even if they are kind of running around, we'd recommend bring the phone, chase them a little bit just so the doctor can have a look. We absolutely do need to see the patient. If the patient's a child, that means we got to see them. We have had some parents, they give us the whole history and it's very detailed. They've got great questions, but if the baby's sleeping, we need to see them. After the appointment, as I mentioned previously, we can provide a copy of the notes to your doctor, your primary care provider, and then if there's any follow-up that's necessary, you can review that with them.
It's good to know that if you know your children bedtime or your baby, like if you have a kind of a schedule to maybe not book this right when they're going to be sleeping if you don't want to disturb their sleep schedule.
Yes, exactly. And I mean, the good news is, if you're booking it at a time and you're, very worried about their sleep schedule, that automatically kind of tells me as a doctor, it's probably not so serious. Because if it was serious, you'd wake them up to to review the case with the physician. Yes. So that's actually a good sign from our perspective too.
Right.
Sorry. I was just going to say one other thing, Heather, before you ask the next question. If you are booking an appointment for something that involves, a dermatological concern, something on the skin, another way that you can prepare is by sending us a photo ahead of time. So somewhere where there's some good lighting, ideally by a window, take a good photo of whatever the concern is. Often it's rashes with little people. And then you can upload that before your appointment. So the family doctor on our side can have a look at that before consulting with you.
Excellent. So now this is for children and adults, is it?
Absolutely. So our family physicians can see the whole spectrum of care from newborns to seniors. Yes.
Awesome. Okay, cool. So now what about keeping us healthy and preventing the spread of the flu, boosting our immune system? What are some tips? How can we kind of help ourselves stay as healthy as possible and hope to not spread anything around?
Absolutely. So right now we're obviously still in the COVID-19 pandemic, as well as flu season. So luckily the ways to prevent both of them are similar. So the first thing that I strongly recommend is washing your hands. And as I was reviewing this with my daughter this evening, she said, you just have to sing happy birthday twice, Mom. That's all you got to do. So that's how long you should be washing your hands for, 20 seconds. Second thing to do is stay home. Stay home if you can, avoid contact with others. That's really going to help to prevent viruses from spreading. If you do need to go out, wear a mask and try to social distance as best as you can. And really important these days is if you haven't had your flu shot yet, I strongly recommend getting the flu vaccine. You may know that for children, there's no near future of the COVID vaccine being available for children under 16. All the studies have only been for children above 16 years old. So for right now, the flu vaccine is the best thing that we can offer them. And the good news, though, is there was a recent study that showed that for patients that did end up getting COVID-19, those that got a flu vaccine actually ended up doing better than those that didn't get the flu vaccine. So it does, have some protection, it appears, for COVID-19 as well.
That's good to know. Now, okay, so now we're preparing for the appointment and everything. And I want to know, is it covered by your insurance? Like I'm in British Columbia, so is it going to be covered by my basic medical card? How's that work?
Yes, absolutely. So in Alberta, British Columbia, Ontario, and Saskatchewan, we are all covered under the provincial plans, so you do not have to pay to speak with a physician. We also offer allied health appointments. So if you wanted to speak with a therapist or a dietitian, we do have those options available through the app, but those are not covered services.
Okay, I see. And for people that are not really, really comfortable with technology, which I'm sure that happens. So obviously we probably recommend download the app ahead of time. We already been on the app to take the appointment and all this, but people that are having a hard time with their devices, like, do you have any tips and tricks around that, or how's that work?
Yeah, it's actually really easy to use the app. So once you've downloaded it, you just have to do some confirmation, make sure that you have a photo ID, just so that we can confirm that you are who you say you are. But when it's time to book the appointment, it's as easy as opening the app and then pressing the button that says book an appointment with a physician. So it really is very user-friendly. My mom, who's a senior, has been easily able to use it to book appointments as well. And although she is somewhat tech savvy, she's maybe not as tech savvy as some of the younger patients that we end up seeing.
And if we don't have an iOS or Android device, so if we don't have a phone, basically, can we use that service?
For right now, we're only an app. So we're not a web-based service. It's only an app at this time.
Okay. So get your phone out and download the app. But apps are the future. Honestly, apps are so easy to, it's so easy to get around. And I think more and more we're all getting, I love my apps on my phone, but I was just curious if some people that doesn't have a phone, which it's not a lot of people, but here and there, you still see that, right? Okay, everybody get your phone out. So where can parents download the app and or get more details about Babylon Telus Health?
Yes, so you can download the app for either Android or Apple, so through the Apple Store or Google Play. And if you wanted to find out some more information about Babylon, you can go to telus.com/Babylon, and it'll outline lots of information about our services, what we treat, our hours, and there's options. There's a phone number. If you have any questions, you can reach out to us through that.
Good. That's awesome.
Perfect.
That's awesome. So if you have technical problem ahead of time, then you can always call.
Absolutely. We have a very lovely support team that is readily available and happy to answer any questions you might have.
Awesome. So Alissia, we can find you on our panel of expert at parenttalk.ca. Where else can we find you?
I'm also on Twitter at Dr. Alissia.
Awesome. So that concludes today's episode. Heather and I would like to thank you, Alissia, for taking the time to be here and bringing so much value to all of us parents, helping us grow and be the best parents we can be.
Great. Thank you so much for having me, and a happy 2021 to both of you as well.
Thank you. Yes. So happy New Year, everyone. Make the most of it. Have lots of fun and enjoy your little one. I hope Christmas was a fantastic Christmas this year, right? I think we all made it. We all made it.
As the best of it, for sure.
Yeah, as beautiful as we can, right? So if you have a question, you would like to join us on the show as a guest or as an expert, please visit the Contact Us section on our website at parenttalk.ca. Follow us on Instagram, Facebook, and soon on Parent Talk TV on YouTube. So of course, you can always subscribe directly to this podcast at parenttalk.ca. We hope you enjoyed today's episode, and we're inviting you to share it on your social media. As we all know, parenting can be hard, so remember it's important to laugh, keep learning, cherish your village, and be true to yourself. Thank you for listening, and have a great week. Bye.